For many retirees, Medicare provides something that is difficult to put a price on: peace of mind. After decades of working, saving, and planning for retirement, most Americans eventually face the same reality. Healthcare becomes one of the most important financial considerations of later life. A routine doctor's visit, a prescription medication, an unexpected hospital stay, or ongoing treatment for a chronic condition can quickly become expensive. Medicare was created to help provide access to healthcare for older Americans and to reduce some of the financial uncertainty that comes with aging. Today, more than 60 million Americans rely on Medicare in one form or another. For many retirees, it represents a critical part of their retirement security, standing alongside Social Security as one of the most important government programs affecting daily life. Yet despite its importance, Medicare is often misunderstood. Many retirees know they have Medicare coverage, but fewer understand exactly what it covers, what it does not cover, and how rising healthcare costs may affect them in the years ahead. At the same time, headlines frequently raise questions about the future of healthcare spending in America. News reports discuss rising costs, an aging population, and growing pressure on government programs. These discussions can leave retirees wondering whether Medicare will continue to provide the level of support they expect in the future. The good news is that understanding Medicare does not require becoming a healthcare expert. In fact, one of the best ways to reduce anxiety about retirement healthcare is simply to understand how the system works and what factors are likely to influence it over time. In this briefing, we will examine the foundations of Medicare, explore what the different parts of the program actually do, and look at some of the challenges and opportunities that may shape Medicare's future. Our goal is not to predict dramatic outcomes or focus on alarming headlines. Instead, our objective is to provide context, clarity, and perspective so that you can better understand one of the most important components of retirement planning in the United States. Because when it comes to retirement, knowledge is often one of the most valuable assets you can possess, and few subjects deserve more attention than healthcare. To understand Medicare, it helps to think of the program as 4 separate parts that work together. Many retirees hear terms such as Part A, Part B, Part C, and Part D, but the differences between them are not always clear. Let's begin with Part A. Part A is often referred to as hospital insurance. It generally helps cover inpatient hospital care, skilled nursing facility care under certain conditions, hospice care, and some home health services. For many Americans, Part A comes without a monthly premium because they paid Medicare taxes during their working years. Next is Part B. Part B focuses on medical services outside of a hospital setting. This includes doctor visits, outpatient care, preventive services, medical equipment, and many routine healthcare needs. Unlike Part A, Part B typically requires a monthly premium, and most retirees pay this cost directly or have it deducted from their Social Security benefits. Together, Parts A and B form what is commonly known as Original Medicare. However, Medicare does not stop there. Part C, also known as Medicare Advantage, allows beneficiaries to receive Medicare benefits through private insurance companies approved by Medicare. These plans often combine hospital coverage, medical coverage, and sometimes additional benefits into a single plan. Depending on the provider and location, Medicare Advantage plans may include services such as vision care, dental coverage, hearing benefits, or wellness programs. However, plan networks, costs, and coverage details can vary significantly. This is one reason retirees should review their options carefully each year. Finally, there is Part D. Part D helps cover prescription drug costs. As healthcare advances continue to introduce new medications and treatments, prescription coverage has become increasingly important for many retirees. Part D plans are offered through private insurers and can differ in terms of premiums, covered medications, and out-of-pocket costs. Reviewing prescription coverage annually can help retirees ensure that their plan continues to meet their healthcare needs. One of the most common misconceptions about Medicare is that it covers every healthcare expense. In reality, Medicare was designed to provide substantial support, but it does not eliminate all healthcare costs. Deductibles, premiums, copayments, and certain services may still require out-of-pocket spending. Understanding these four parts is an important first step toward making informed healthcare decisions during retirement. The more familiar retirees become with how Medicare works, the better prepared they are to evaluate coverage options, manage healthcare expenses, and make confident decisions about their future care. As important as it is to understand how Medicare works today, many retirees are equally interested in what the future may hold. Questions about rising healthcare costs, government spending, and an aging population often generate headlines that can create uncertainty. While no one can predict the future with complete accuracy, there are several important trends that retirees should understand. The first is healthcare inflation. Historically, healthcare costs have tended to rise faster than general inflation. Advances in medical technology, new treatments, prescription medications, and longer life expectancies have all contributed to higher healthcare spending over time. This is not necessarily a negative development. Many medical treatments available today simply did not exist a generation ago. People are living longer, healthier lives because of these advances. However, these benefits often come with additional costs. The second trend is demographics. America's population is aging. Every day, thousands of Americans reach retirement age and become eligible for Medicare. As the number of beneficiaries grows, the program must support more people while continuing to provide access to healthcare services. This demographic shift is one reason policymakers frequently discuss Medicare's long-term finances and future sustainability. Retirees may hear discussions about trust funds, budget projections, reimbursement rates, or potential reforms. These conversations are likely to continue for many years. However, it is important to distinguish between headlines and reality. Throughout its history, Medicare has experienced numerous legislative changes, funding adjustments, and policy updates. Yet the program has continued to evolve and serve millions of Americans. Understanding these long-term trends can help retirees place future news and policy discussions into proper context. As we conclude this briefing, perhaps the most important lesson is that Medicare should not be viewed as a static program. Like many government programs, Medicare continues to evolve over time. Changes may result from new legislation, budget negotiations, healthcare innovation, economic conditions, demographic trends, and shifting policy priorities. Different administrations and Congresses may approach healthcare policy in different ways. As a result, retirees may occasionally see changes to costs, coverage options, enrollment rules, or program administration. For this reason, staying informed is one of the most valuable habits retirees can develop. Rather than reacting to every headline, focus on understanding how specific changes may affect your own healthcare coverage and retirement plans. Review your Medicare options regularly. Pay attention to annual enrollment periods. Monitor official communications regarding benefits, premiums, and coverage updates. And remember that retirement planning is not a one-time event. It is an ongoing process that benefits from periodic review and adjustment. The most successful retirees are often not those who predict every change perfectly, but those who remain informed, flexible, and prepared as circumstances evolve. Healthcare policy, government programs, and economic conditions will continue to change. Knowledge and awareness remain some of the most valuable tools available to retirees. At the Retirement Briefing, our mission is to help you understand the economic forces shaping retirement in America so that you can make more informed decisions with confidence. Thank you for joining us for this edition of the Retirement Briefing.